My dear friends, here at the LibertyCon 2025 in Prague, we have another panel discussion, and I'm really happy that we can introduce our next guests. There are many of them, so let's start. First one, Alberto Fernandez, Policy Manager at the World's Vapers Alliance. So please, big applause. Second guest, Federico Fernandez, CEO of We Are Innovation. Next one, Martin Pánek, Director of the Czech Republic's Institut, liberálních studií. And Tom Palmer from Atlas Network and lifelong advocate for freedom of choice. And leading this conversation on the failures of prohibitionist policies is Reem Ibrahim, Communications Manager at the Institute of Economic Affairs. The stage is yours. Enjoy our discussion.
Thank you so much for that. That's really wonderful. And thank you to all of you for coming to watch and listen. And thank you to all of my wonderful panelists here today. So we're going to be talking about prohibitionism. Now, prohibitionism is, of course, something that has occurred across various different countries. And the nanny state appears to incrementally increase in their own particular intervention in people's government, in people's lives. And so fundamentally, as libertarians, all of us would agree that individuals should be allowed to decide what they do with their own lives and with their own bodies, and that it is actually morally right for an individual to decide what they do. Now, from a public health perspective, there are so many different angles to this, even from a policy perspective, in which governments continuously intervene in people's lives. And we've got a fantastic panel to discuss this as well. So I'm going to give each of our panelists about 5 minutes to deliver their introductory remarks, and then we're going to throw it over to the audience so all of you can ask us some questions as well. So let's start off with Alberto from the World Vapers Alliance.
Thank you. Thank you very much, Reem. Thank you, everybody, for being here, coming to listen to us. As Reem said, I'm Alberto. I work for the World Vapers Alliance. We are a community of vaping and alternative nicotine product advocates. What we push is for these alternative products to have proper regulations so that smokers can use them as a safer alternative to consume nicotine. And what we see in the last 2 decades, since vaping became an alternative for smokers, is that governments all over the world are trying to restrict freedom of choice of the consumers. We see that this is happening under 2 things. One is the excuse of the protection of the youth, which is something that probably a lot of you have heard about, this idea that all kids are taking vaping and that vaping is a gateway to smoking, which is completely anecdotal, I would say. It's something that is not happening in big numbers, and also is something that the media echoes a lot. It creates a lot of media hits and trouble, and then policymakers use it as an excuse to restrict the choice that adults have to use these products. And second thing is the completely paternalistic and idealistic approach that policymakers have towards public health. We know that they want to protect public health, and the way that they do it is by restricting everything that they don't like instead of giving consumers safer alternatives to consume the things that they want, but in a less harmful manner. We have seen this all over the globe in the last 2 decades. There are many countries in which vaping or alternative nicotine products are fully banned, especially outside of Europe, like in Latin America, Africa, and some Asian countries that are very harsh with restrictions on these products. And also in the European Union. We have a huge battle ahead now in the upcoming years. The European Union needs to revisit their tobacco rules, all the regulation in tobacco and emerging nicotine products. And there are a lot of things that they want to ban. They want to ban vaping flavors, which are a key element for adult smokers to be able to switch because it helps them to forget about the taste, the flavor of smoke, of cigarettes. And also they want to ban disposable products. This is something that some member states, some European countries are already doing. And it's a huge threat for freedom of choice, for consumers, and also for public health, because all this is causing is leading consumers either back to smoking or to the black market, where the alternatives and the products are really not safe, or we don't know what they contain. There is no traceability of them. So yeah, this is a big danger that we're fighting right now, and this is why it's important to talk about it. Thank you.
No, I think that's really interesting, especially when we're thinking about it from a public health perspective. Now, again, as libertarians, all of us will agree that adults should be allowed to have that choice to smoke or to vape, or to do whatever it is they wish to with their own bodies. But even from a public health perspective, so from a first principles basis, we believe those adults should have the moral right to do what they want with their own bodies. But even from a public health perspective, restricting the use of vaping products results in adults being less likely to quit smoking. So I think that especially in the UK, we're trying to not just make the pro-liberty argument, but also the evidence-based argument. And when you follow the evidence and allow adults to choose safer and healthier products, it is actually beneficial for their health as well as a pro-liberty stance. Let's now give 5 minutes to Tom Palmer from Atlas Network.
Well, thank you kindly. There are a couple of things I think it's very important to keep in mind to have a thoughtful discussion. So the term prohibition, are we against it? Well, no. I'm in favor of prohibiting lots of things, murder, rape, theft, and so on. The focus is on prohibition of victimless crimes. And the key here to understanding victimless is that there's no complaining victim. No one who goes to the police and say, I want this person arrested. Oh, who? Me. Right? This doesn't happen. Victimless crime sets up a dynamic in which, without a complaining victim, the state has to take the initiative to spy on people, to entrap them, to follow them, to go into their homes, to catch them engaging in this behavior, because there's no one who would complain about it, who is victimized. But the second point to keep in mind, to say there's no victim is not to say no one is harmed. I think we should be very clear-eyed about this. So I've had family members and dear friends whom I have watched very painfully kill themselves with alcohol and narcotics. So there are people who suffer, not only the taker of it, but the families and the friends also suffer from this. So we don't want to say, oh, no one is harmed. Yes, of course, the abuse of these things can lead to harm to other people, to family and friends, as well as the person. So we should be very clear-eyed about this and not engage in fantasies about how these behaviors are entirely harmless. Vaping may be, but certainly alcohol and narcotics, it's not the case that no one is harmed by their abuse. There are other ways of dealing with these, and state prohibition always makes it worse. The empirical evidence are overwhelming. Why? Because of the victimless crime dynamic. It means the state begins to use violence against nonviolent people, and people who are suppliers use violence against them. It's outside of the law, and the consequence is that we see disputes are resolved with gunfire and brutality and violence rather than in courts of law or in negotiations. So if you look at the prohibition of alcohol in the United States, is such a clear example. 1919, it's prohibited. The homicide rate had been falling for the previous 60 or more years. Suddenly it goes up. Every year that alcohol is prohibited, the homicide rate goes up until it's legalized, and then it falls for 11 consecutive years. Now, we all know correlation is not causation, nice thing to keep in mind, but anytime you see that, a little light bulb should go off. Something is happening here. Something caused the murder rate to go from slightly declining to rapidly increasing. When the policy is changed, it's changed again and it falls. Very clear evidence of a causal connection because of the involvement of violence in this. There's also an economics we should keep in mind, that the way in which it makes it worse is by pushing people to more concentrated versions. If you're trafficking an illegal substance, do you want to smuggle in beer into the United States from Canada? That's a small amount of alcohol in a big volume, or whiskey, vodka, and gin. So there was a shift from beer consumption to whiskey, vodka, and gin consumption, which leads to all kinds of additional health problems. The same thing has happened in the narcotics industry as well. Much more concentrated versions of the drugs and narcotics, and often with terrible consequences. And as we've seen also, because of the lack of knowledge of purity, more overdoses, more sufferings, more poisonings, and so on. And I'll leave with one last thought. This is a category of an entire field of social control of society by the state and its appointed leaders and guardians of public virtue that extended beyond merely alcohol or narcotics, or in this case vaping and nicotine consumption, but also sexuality, love, gambling, socialization, going to bars, all these kinds of activities. And the vision that I want you to leave you with is not that things are always getting worse or always getting better. Sometimes they get better and sometimes they get worse. And the peak of the prohibitionist movement is not in the ancient times and it's been getting better. It got much worse during the so-called progressive era. Late 19th, early 20th century is when lots of this nonsense began. Prior to that time, there was no legal penalty for most of the behaviors that were later criminalized, including homosexuality, which surprises many people. But in North America, every criminal prosecution for homosexuality was for rape or public indecency and exposure, not for private behavior. Because under the law, a willing participant could not be a witness in a criminal case. So no prosecution as a consequence. It got worse. Now we hope it's going to start to get better because of you.
It's really interesting, especially thinking about it when you're expanding this entire notion that the state should have these kind of controls over your individual lives, and Tom has just described that very articulately. Now let's go to Martin Pánek from the, use one of those mics, from the, is it the Director of the Liberal Institute over here in Prague.
So guys, I will tell you one thing that I'm sure you will be very shocked by. The nanny state is bad. But I don't know how many Czech people are here in the audience. We co-published the nanny state index with the IEA. We used to be the best or the least bad country in Europe in this index. Then we were second, and we are publishing a new edition this year. We are getting worse. So I don't have a positive message about this. We are slipping. I wanted to mention another thing. We were the last country in the European Union that still allowed smoking indoors in restaurants. Now, I don't smoke. I don't like smoking. I've never smoked one cigarette in my life. But I think that it should be the decision of the owner of the restaurant, not the decision of some policymaker here in Prague in the parliament. And I don't like smoking, but I don't like state prohibitions even more. And I won't use the full 5 minutes like my learned colleagues here, but I wanted to mention our mission to Ukraine, where we kind of flipped the script because a lot of the money that we raise is from drinking beer, and you can support the mission outside with our beer, and but that's not. Thank you. But an interesting case of prohibition we realized exists on the border between Ukraine and the European Union, because you're only, at least when you're crossing into Poland, you're only allowed to bring 2 packs of cigarettes, which is mental. And if you bring more than that, you will spend hours more on the border. You will spend like 2 hours filling out various customs forms, and then they will confiscate the cigarettes. So it's incredible. And I remember the time when the Czech Republic was not a member of the European Union. We were allowed to bring 1 carton of cigarettes into Germany, which was a much more sensible policy. And if you brought more, the police told you, pay the customs or give us the cigarettes, and that was it. It was done in 5 minutes. So this is incredibly bad. A lot of people don't know that the limit is so small. It's because of the VAT, of course. The Polish government and the EU want to get the VAT from the cigarettes, but it's bad and illogical and inefficient nonetheless. So that's my 2 cents for the future debate with you.
Bad and illogical is exactly how I would describe the nanny state. If you are interested in looking at the nanny state index, we are publishing our next edition, as you mentioned, in May, and we co-published that with various different think tanks across Europe, where we are able to rate and give every single country a different score based on that. So interesting, the UK also went down from 11th bad, then made it to the top 10 as 7th in this year's index. So that's a bit of inside knowledge for you. But it is interesting, we will have our own website for the Nanny State Index as well, so you can learn a little bit more about where your own country might land on the Nanny State Index and where it ranks across the world. Germany's been the most free country for a long time, which is interesting. Do we have any Germans in the room? Any Germans? Yeah. Well, you guys are more free to smoke, drink, vape, and gamble than anybody else in this room, so that's great. We'll now go on to Federico Fernandez from We Are Innovation.
Thank you, Reem. I'll just stand because, after all these gentlemen and at least I have to, stand up in a way. And I'll try to be quick as well. And Alberto, I'll change a little bit what you asked me to say, because he asked me to talk about what's going on in Latin America regarding alternative nicotine products. We can leave that there will be Q&A, and I see there are some people from Latin America, maybe if they are interested, but let's, I am from Argentina. Most of the work I do is to promote innovation and freedom, and I work with a great team, which is present here, by the way, with Tania, Bea, and Lasha. So I'm a very happy person. So I want to focus. I know that the panel, and I understand, and let's say I fully agree that bad policy has even worse outcomes. But I want to focus in certain things that Europe, for instance, is doing very well and are related to the topics we are discussing today, and can give us a lot of hope in many ways. For that, just let me tell you 30 seconds about what we do at We Are Innovation. We Are Innovation is a network currently of 50 partners, all think tanks, NGOs, and foundations from all over the world. And as the name states, we try to defend innovation. And we try to focus on topics that are, of course, innovative, but also have a very profound human impact. Let's say space exploration, it's amazing, but it's something that from now we have been avoiding to a certain extent, because it's not something that is present in our daily lives. There are other issues that are innovative and that we have in our cell phones all the time, or present in our lives, and that's what we want to focus. And in that regard, as you can imagine, we don't have a prohibitionist view, but smoking is a problem. I have small children, I suppose they don't want to smoke yet, but I'm not going to buy cigarettes for them. Smoking is not the best you can do. It's bad for you. Again, we are not prohibitionists, obviously. Adults should do whatever they want. But if, particularly, thinking of people who currently smoke, you could provide them alternatives to consume nicotine without destroying their lungs and their heart, that would be a no-brainer. That really, unfortunately, as Alberto explained at the beginning, it's a little bit more contested. But, and now I want to go to the example that we have here in Europe. The European Union, better said, which is not the same as Europe, the European Union has a smoking prevalence average of 24% of the adult population. That's still very high. We tend to think that people don't smoke anymore. That's not the case at all. A lot of people still smoke, and in other countries it's even worse. But in the European Union, the average is 24%. Europe wants to become smoke-free, but the EU, wants to become smoke-free by 2040. If the current trends continue, Europe won't be EU won't be smoke-free by 2100. So there's a lot to do. But in Europe, within Europe, you have, and it's very funny because Sweden is like the country doesn't exist. We have Sweden, a country, by the way, who should have disappeared during COVID and didn't, but it's like the country doesn't exist, It's the only conspiracy theory that I believe is that Sweden doesn't exist, because nobody pays attention at what's going on in Sweden. Sweden has 5.3% of smoking prevalence, which makes it technically smoke-free. And the individuals who have been under, let's say, the Swedish model all their lives are smoke-free, because it's 4.3%, I think. Europeans who moved to Sweden from 24%, the smoking rate lowers to 7.8%. How has Sweden achieved this? And I'll finish in 50 seconds, don't worry, Reem. How has Sweden achieved this? Basically making alternative nicotine products accessible. This means that they are relatively, for adults, relatively easy to buy. In shops, they are not treated as pornographic magazines. That means that they are hidden, they are just, in plain sight. Oh my God, babies are not smoking or, vaping or anything like that. These products, as I said, are accessible. They are acceptable in the sense that if you currently smoke, you can find something that can help you replace smoking. If you turn, for instance, vaping into a bad photocopy of a cigarette, nobody is going to, very few people are going to replace smoking with vaping. Vaping, for instance, these products can be accessed in different flavors and different nicotine levels. And these products are affordable. The tax treatment that alternative nicotine products have in Sweden is way lower the tax than the tax of cigarettes. With these three things, which basically can be summarized, treat adults as adults, Sweden has made smoking almost disappear. This is something Europe and the rest of the world can learn, and this is how innovation has basically helped us solve a problem. Thank you very much.
Excellent. Thank you so much for that. Really, really excellent insights from all of our panelists. And before I throw to the audience, I just wanted to talk a little bit about the UK perspective in which we have effectively banned, or we are about to ban, tobacco products across the board. So most people don't know about this, a lot of people haven't been talking about it, especially around prohibitionism as a whole, because it isn't explicit. But what the government are doing is, through the Tobacco and Vapes Bill, which is currently being passed through the House of Lords, they are going to be incrementally increasing the age of sale of tobacco so no one can buy tobacco products. So in terms of treating adults as though they are adults, what we are doing is we are treating the adults of the future as though they will be children forever. We are literally treating them as though they will forever be under 18. And what's going to happen is anybody that was born after the 1st of January 2009 will never be able to legally buy tobacco products. Now, one thing that wasn't necessarily mentioned on the panel, but I think is really important, is there is this assumption with nanny statists and these kind of public health advocates that whatever the government does or whatever the government bans or restricts or prohibits results in it just being eradicated from the market, which is obviously just not true. I mean, one example is in the UK, we've taxed tobacco so highly that now people just buy it illegally. So over the last few years, the smoking rates in the UK have basically stayed the same, but tobacco receipts, so the amount of money that's being raised by the Treasury in tobacco duty, has declined by 41%. Now, we know from smoking rates, people aren't smoking any less, so what's happening? They're getting their tobacco illegally. And I've seen this happen in front of my eyes. So what's interesting is this assumption that all of these products that the government will end up banning can just simply be taken away at the drop of a hat. The government and as a society, we have two different choices. Either tobacco is provided by a taxed and regulated private sector, or it is provided by criminal gangs. There is no third option in which it's provided by nobody. So I think that's one particular example in which the UK once was quite free and is now declining on that slippery slope towards prohibitionism. Okay, let's open it up to the floor. I mean, we've got so much interesting things to say. Who has any questions? Yes, we've got some at the front. We've got a microphone. Introduce yourself as well, if that's all right. Thank you.
Hello to you all. My name is Adam Wolf. I'm from Ireland. What we've discussed so far has, excuse me, has largely hinged on recreational habits, so smoking and drinking. But what about the case of an international pandemic, in the case of explicitly COVID, which we've all experienced? And I speak here especially in reference to the experience of this country, of Czech Republic, which from the outset implemented what would be a quintessentially prohibitive policy, but which at the time could not be really called a bad outcome in terms of the lowest rates of death. So where does this lie in your opinions?
I think this is a little more difficult than some others because infectious diseases have obvious externality impact on someone else. So if I walk in and I've got an infectious disease and I infect the other people in the room, I've imposed a harm on them. Now, what is the right policy is driven by evidence and facts. So the principle is don't harm other people. Well, what's the threshold? If I have a common cold, if it's a very low risk, and so on. And these are matters to be decided empirically. We've now seen from the COVID experience, in some cases, very foolish policies were implemented, notably the lockdowns in schools in many countries. Children lost 2 years of socialization and schooling, and it's now showing up, the very negative consequences, the harm that was visited on them. So I don't think there's a principled answer. You can say, this is the truth, and I know it from first principles. It's a matter of facts and evidence. There is something called public health that is different from private health. Let's take being overweight, for instance. That's a private health problem. It can be widespread, but it doesn't make it a public health problem because you can't catch it from another person or give it to another person. But the Black Death, yes, you can. And half of the European population was wiped out by it, and there were public health measures, including really extreme lockdowns. Well, were those justified or not? You can make a case for it. In the COVID case, I think we're now in the position to begin to evaluate it seriously. But I'm not one of those who either endorse total lockdown or absolute let anyone do anything. Finding the right balance is a very hard problem in that case. Any other thoughts? Okay.
I would largely agree with you. We didn't know, nobody knew how to deal with it, and a lot of it seems maybe stupid in hindsight, and a lot of the regulations were stupid even when they were implemented. Like we had a ban where you couldn't travel from a district to district, but Prague itself doesn't have any districts, so you could move around freely in Prague, which is very big, but my home district is small and people couldn't cross the district line. And sometimes the district line even goes through houses. It's not an international border, so it didn't make... So some regulations were idiotic from the outset. A lot of it seems stupid in hindsight, but we didn't know what we were dealing with, so I cut a lot of the people a lot of slack. But I do have to say that my opinion of libertarians went really down during the pandemic. A lot of libertarians just, I think debased themselves into conspiracy theories and into abject sloganeers. And my opinion of epidemiologists actually went up because I saw a lot of economic insight in their recommendations. They weren't saying we need to ban everything. They said correctly, well, if we do that, people will get tired of it and we won't have this result. And so that's my lesson from the pandemic.
If I can just add to that, I think what's interesting is, so from my perspective, no government should ever have the right to tell you that you can't leave your home. And I think that the quite egregious and quite draconian lockdowns that some countries experienced actually had really no impact on mortality rates. I mean, at the IEA, we published a paper about a year and a half after COVID lockdowns, and we looked at the comparisons between mortality rates in the UK and in Sweden, which didn't lock down, so we do have an example of a country that didn't have that kind of draconian lockdown. And there was a 3.2% difference in mortality rates between Sweden and the UK. Now, obviously every death is a tragedy, but the question from a public health perspective is that marginal difference worth the huge social and economic costs of lockdowns? And I would probably say no. Any other questions? Yes, there's a few here. Let's take a couple at the same time. So let's do those two at the back. And then we can move to the back.
I wanted to ask a question regarding the vaping and vaping flavors, which, as I see it, is important to look at the reasons for the bans on flavors, which is obviously because mostly flavors and the bright colors are used to market towards kids, and it's been proven. And tobacco and vaping companies have been caught marketing towards kids. So wouldn't the best way to bring back flavors would be finding ways to stop tobacco and vaping companies prevent them from grooming kids into trying the most addictive substance known to man, which is nicotine?
Yeah, regarding that, I mostly agree. I think there are some bad practices from part of the industry that are they are creating products with very attractive packaging and names of the flavors towards kids. And these are a danger. This is causing the rest of the industry who does good practices to feel the same pressure and the same problem from policymakers and the public opinion. But we have to keep in mind that restricting flavors totally will be a public health disaster. There are so many studies around vaping flavors, and it's been shown that using vaping flavors increases the likelihood of quitting in 230%. This is huge. And vaping without flavors is not as effective for smokers who are trying to switch. So we obviously need to strike a balance there. It's very difficult, but also banning flavors is not going to prevent kids from accessing the products. I mean, all these products are already banned for underage people, and they are still getting them from the black market. We have a huge import of illegal products coming from China mainly, and people are getting access very easily to them, kids. So what makes us think that if the governments ban these products or these flavors, they are not going to be accessing it?
Point out, we've also had a terrible experiment, the real experiment in banning flavor for 200 years. It's called English food.
Touche, touche. Although if you've tried a proper fish and chips, Tom, I'm sure you'll enjoy it.
The Czech cuisine isn't much better, to be honest.
That's very good. I will say on the point about youth vaping, I mean, it's pretty overstated. In the UK, we're now banning disposable vapes completely in the UK, and it's coming into force this summer, partly as a result of this moral maze about youth vaping. But there are double the number of 11 to 17-year-olds that drink alcohol regularly than vape regularly. But no one is saying, well, we should ban alcohol for everyone because there are some kids that manage to get their hands on the product. And again, it is already illegal for them to access it. So clearly the problem is law enforcement, not more bans for everybody else. Other questions? We've got about just under 15 minutes left.
Hello, I'm Gia from Georgia. So I have two comments. I want my friend Tom to answer to this. First is that when we are having bad policies, that means that we are shifting personal responsibility towards the government, which ends always with bad outcomes. But the second thing is that bad policy, as I lived in Soviet Union and I know many things about that, bad policy attracts bad politicians. That's very important thing, that you can think about bad policy like, oh, maybe we can change it, but it's never easy to change that because we collected their bad guys and they don't want to change it anymore. Thank you.
A very quick point. It's a very nice advertisement for a book I produced called Self-Control or State Control. There are mechanisms of self-control that are also socially embedded. And I mentioned narcotics and alcohol and my experience with family and friends dealing with this. And Alcoholics Anonymous is a voluntary organization of alcoholics who helped each other, and Narcotics Anonymous. And these are far more successful than various state control programs. They're not 100% successful. I can tell you one of my friends had been for a couple of years and he finally went back off and killed himself with alcohol. But they are good programs that are largely successful, that don't rest on coercion. And so we should think about social mechanisms that are voluntary to help people to get control over their own lives. And there's a substantial literature and practice in this area. And the last point about bad politicians, this invites corruption. Vaping is a good example. I've seen the police officers in Thailand who vape and bust places and then shake them down. So there's a deal that you can get vaping products, but the police get a cut of every vaping product in effect in Thailand. And this is not unique to vaping. It is pervasive. Even when I came back from Ukraine once, I made a mistake. I went in with a caravan of help groups, one of whom had marijuana. I said, oh, for God's sake, what's wrong with you? I was not in that van. When I came back, I gave my car to some Ukrainians to take to the front, so I didn't have a car. So I said, oh, well, you can travel with this guy. I said, wait, he was the one who had the drugs. No way. I don't want to go back. I said, no, dude, it's clean. I said, oh, God. I was really sweating coming back into Poland. We were stopped by the Ukrainians. The guy went through everything. He said, you have marijuana? You have marijuana? Where's marijuana? I said, no, there's no marijuana. And he said, why not? And it was clear what he was hoping for was a cut of the product. So this degrades law enforcement and degrades politics systemically.
Does anybody else want to come in? Or are you okay? I think this is also, by the way, the politics of the nanny state. It's politicians that want to be seen to be doing good things, and they're not going to do it by tax and spend because it affects the economy as a whole. And so what they do is they like to be seen to be protecting public health. And so part of it is, if we're going to regulate alcohol use, we're going to implement minimum alcohol pricing, we're going to ban tobacco. And it's like we're a good politician because we are being seen to be doing good stuff, when in reality, of course, there are a whole host of those unintended consequences. So I think a lot of it is actually just the case of political incentives and politicians wanting to be seen to be good. I think that's probably the politics of the nanny state. Other questions? I can't see any others. Oh yeah, at the back.
Thank you very much. Reem, you mentioned that in the UK we've had a pretty steady amount of people smoking, but the receipts for tobacco duty have gone down just over 40%. You see also in certain Eastern European countries like Romania and Bulgaria, where they take the approach of analysing bins in cities to find legal and illegal tobacco packs, that you've got the same story. The packets have remained pretty constant, as have smoking rates, but then the illegal packets have represented a greater share of what they find in the rubbish bins. Putting aside moral arguments and all our strongly held convictions, are we ever going to convince these people that prohibition just doesn't work?
Anybody want to come in? Yeah.
You've raised a very interesting point about interests and in particular revenue questions. One of the reasons why alcohol prohibition was ended in the United States was precisely the collapse in state revenues from the Great Depression. And they looked around and said, for the love of God, we need money. Wait, if we legalize alcohol, we can tax it. And they tax it very, very heavily. Not as heavily as Europe, but heavily nonetheless. And this has also been one of the things that has driven the legalization of marijuana. There's tax revenue available in that. And I'm not happy with that, but I think if that's what brings about an end to the prohibitionist state, I'd rather have it sold and taxed than prosecuted and so on. So bringing up the tax revenue issue is a winning part of the coalition. And in those efforts that I've been involved in, the one that gets the members of the state legislature, town council to go for legalization is not the ones like us who say it's a principle, it's the ones who say, wait, there's more money we can spend. And so let's add them to the coalition.
I'd like to come in with a case of a bad legalization here in the Czech Republic. I don't smoke cigarettes or marijuana, so the audience may correct me on that. But I feel like smoking a joint even in front of a cop is fine, and you won't get harassed. But you can correct me on that. So it's like it's illegal, but nobody cares. But the Pirate Party came up with this plan to legalize marijuana, but it was so bad it would have made the situation a lot worse. There were limits, like very small limits on how much marijuana you can grow. You would have to register with the state, and the state would check how much marijuana you smoke. Like, of course, in the legal establishments, you couldn't. It was so overregulated, and they were proud that they came up with a world's unique system of legalization. I mean, come on, just translate the Colorado law if you want to legalize it, or something more sensible. This was so terrible that I'm actually glad it didn't pass.
Quick thought on that. Someone who's worth reading on this question, if you're really interested in the deep economics and social policy of prohibition, Jeffrey Miron, M-I-R-O-N, of Harvard University, in the economics faculty. He's also vice president for research at Cato Institute. And he's written extensively on the economics and the social consequences of prohibition of narcotics, alcohol, other substances. And he points out decriminalization is often worse than legalization. Why? Because when you decriminalize very small quantities, you increase the demand for it, but you did not decriminalize the production. And the consequence is it brings about more of the negative consequences of prohibition. So legalization, just say it'll be treated as a legal substance, you could produce it, sell it, market it, and so on, is far superior to these decriminalization efforts about small quantities and so on. Those end up with worse consequences than a just flat-out legalization policy. So sometimes these incremental, particularly weird policies like that make the situation worse and not better.
Amazing, thank you. Anybody else want to add anything to that? Or yeah?
Just something quickly. I was thinking of examples of, destruction of innovative products or innovative models, or business models via legalization. And I remember, this is still going on, by the way, in many countries of Latin America, but companies like Uber or Airbnb were basically operating, and then some genius wanted to legalize them and created a framework which basically destroyed their business model and made them not viable anymore. That happened a lot. And in Chile, something very interesting happened. This is, I think, a great innovation in Chile, but it will end up it ends with a good ending. Chile at one point legalized vaping, said, but vaping products will only be sold in pharmacies. Pharmacies will have to get a permit, a special permit for this. No permit was ever issued. So, but by the way, and with this is the happy ending, Chile finally, a couple of weeks ago, literally has passed a law very smartly regulating vaping, allowing a lot of liberties that, by the way, many people not even here in Europe have. So there's always room for improvement, and Chile shows that as well.
Amazing. Thank you so much. Federico, Martin, Tom, and Alberto, thank you so much for joining me today, and thank you to all of you for listening. Thank you.